So welcome back to Voices in Health and Wellness. This is the podcast where we explore the people, ideas and innovation shaping the future of healthcare. Today we're diving into a fascinating area of dentistry that challenges the traditional approach of drill and fill and instead focuses on prevention, regeneration and preserving natural tooth structure. We'll be discussing how new technologies are helping clinicians detect problems earlier and how artificial intelligence is changing diagnosis and treatment planning, and why the future of healthcare may be less about managing disease and more about preventing it altogether. I'm delighted to welcome Dr. Roumiana to the show. Roumiana is a dentist and practice owner based in Long Island, New York, with more than a decade of clinical experience helping patients achieve better oral health through minimally invasive and prevention-focused care. So with that, Roumiana, I'd love to welcome you to the show. Thank you so much for joining us today.
Good morning, Dr. Greenland, and thank you so much for having me. It's truly a pleasure.
So let's start with your story, if we may. Could you tell us a little bit about what attracted you to dentistry in the first place? I know it's probably a while ago, but it's always helpful and interesting to hear about the context and the background of our guests.
Yes, sure. I grew up in Sofia, Bulgaria, and my mom is a retired oral surgeon. So I was exposed to dentistry ever since I was a little girl. So I do vividly remember I was 13 years old. School had finished and I had nothing to do during the summer. So my mom's dental assistant got sick and I had to step in, had to start working as a dental assistant. And I remember when she extracted a wisdom tooth and she mounted that on a stone. And I drilled and removed the amalgam filling back in the days. That was the material we used to use, and filled the cavity. And I think that was the moment when I had decided that this is the path for me.
Lovely, thank you. And how has your kind of journey eventually led you to become a practice owner?
That's an excellent question. I came to the United States when I was 15 years old and went through high school and college. And I got homesick, went back to Bulgaria and decided that I will enter dental school there. So that's what I did. I graduated dental school in 2008, opened up my own practice in Bulgaria and worked as a dentist for 6 years before I moved back to the States again, because something was feeling very small and I wanted to come back for good this time and explore how the American way is when it comes to treating patients. So I graduated Tufts University in 2019 and joined Aspen Dental that same year. Worked as a clinical director in Rhode Island for 4 years. And then the opportunity to have my own practice came in 2023. So I moved from Rhode Island to New York, where my parents live, and became an owner.
Amazing. So would you mind giving us a little bit of an overview of Aspen Dental, what your practice looks like today in 2026?
Well, Aspen Dental is a DSO that is mainly for people who, haven't seen the dentist in such a long time. Those are the people who have barriers on emotional and financial level. So we deal with those type of patients. I was trained to be a very conservative, minimally invasive dentist back from Bulgaria, because in Europe I trust and I still believe that there is a discrepancy between the United States and Europe of the approach. So when I first started, there was a lot of extract and insert cases, a lot of hopeless teeth that I had seen. But as I had built myself as a dentist, I realized that there is always an opportunity to save 8-10 teeth, because nothing can replace the natural dentition. So when I moved to New York, I guess the population is just slightly a little bit different than the population in New England, in terms that when you work in a big city, even though we're in the suburbs, it's still very close to Manhattan, people are more self-conscious about their teeth. Their emotional and mental health, I feel, and as I work with them, is a lot more stable. So to them, losing all of their teeth is non-negotiable. So I guess in a way, the patients that I work with help me be the dentist that I've always wanted to be.
Thank you. Now, when you look at dentistry today compared to when you first entered the profession, what changes stand out for you the most?
A lot of changes. I can't pinpoint only one, but the recent ones that have aligned with my ethical and moral beliefs as a dentist are two products that I've been utilizing in my practice and within Aspen, of course, because I do work under the umbrella of Aspen. One of them is a AI tool. It's a platform by VIDIA. It enhances our diagnosis because it shows what the human eye cannot detect majority of the time, because sometimes the lesions, cavities don't form overnight. It takes time for that small lesion to enter the bulk of the tooth called the dentin and reach to the nerve, right? It's not something that happens overnight. However, the human eye is very interesting. It can only detect to a certain degree. So the platform that we use at Aspen Dental helps us I wouldn't say detect, but it enhances our diagnosis. It is more visual, and it makes the transparency more clear, I would say. What we see is what patients are able to see now because it's color coordinated, and it helps a lot when we have to build that trust with the patient. And the other one that we recently have launched in Aspen is something called Curodont. It is by this firm called Vivardis, based in Swiss. It remineralizes the enamel and it regenerates the enamel. It's pure science, and I'm in awe of what dentistry has come up with.
Amazing. And in terms of client expectations, patient expectations, how have those changed in the last 10 years in your experience?
I do see that a lot of the time people who had implants and a lot of teeth being extracted back in the days 10, 15, 20 years ago, when implants were and still are the best way to restore missing teeth. They do come with, let's say, a full arch of implants and something fixed, and they still have their natural dentition on the lower for some reason. Their approach is completely different. I would say that majority of the time they would say, "Doc, do something to save those teeth," because I feel that they at this point realize that nothing can replace the natural dentition. And again, those type of mentalities do help me to be the dentist that I am today.
Thank you. And are there any other big misconceptions that patients still have about oral health that you've kind of picked up on?
The misconception, I think one of the biggest one is when they say, "I stopped flossing because my gums are bleeding," and then we go into that vicious circle again of explaining why the gums are bleeding and why they need to floss, and the more they floss, the less the bleeding. And the other misconception is, again, we're going back to implants. I'm going to replace all of my teeth with implants so I can have a better smile. But there is so much more into extracting teeth and replacing them with implants. There is anatomy, there is soft tissue, there is hard tissue that we all need to think about and treatment plan before we start taking out teeth and I would say crippling those patients. So when a patient like that comes to my office, I do spend over an hour explaining the pros and the cons. There is a lot of misconceptions about overdentures and all-on-X. And both treatment plans are expensive but there is a component in which they still don't understand how an overdenture is still something that they need to take in and out, even though they have implants. And this is where we sit down and the discussion is extremely thorough.
Now, one thing that stood out from an earlier conversation we had was your focus on minimally invasive dentistry. So for listeners that may not be familiar with that philosophy, what does it actually mean in practice?
Minimally invasive dentistry is a term that I use for everything that I can do in order to prevent future extensive and expensive dental treatments. For instance, when I see a small lesion that is still within the enamel, which again, the AI platform that I use by VIDIA in my practice helps me enhance and visualize that diagnosis. I would rather prevent the cavity to extend to the bulk of the tooth by applying Curodont. And then if I see a small cavity, my prevention would be, let's do a filling before it becomes a deeper filling where I need to do pulp indirect, for instance. This is a medication that we put on the top of the dentin that is very, very thin. This way we can prevent the hypersensitivity in a future root canal treatment. If somebody comes that needs a root canal treatment, I would prefer to do a root canal treatment versus extracting the tooth. So see, this is when I say minimally invasive, it doesn't mean that I would see a big, huge lesion that is, class 4. For those of you who don't know what a class 4 is, this is when the incisal edge is included and you need to do a crown or a veneer. That's not the case. The case is to prevent the more extensive, painful, and expensive dental treatment down the road.
Really interesting. I'm really fascinated by this Curodont, and you've just mentioned it, but what's happening biologically when this treatment is used? Just give the listeners a little bit of the scientific background just to understand a little bit more about this.
Yes, so Curodont is a treatment that regenerates the enamel from within. But again, it works on non-cavitated lesions. Those are the white lesions and white spots that we see on the facial aspects of teeth when people had worn braces, for instance. And who hasn't have those white lesions? We all know that back in the days, we would just do a mesial facial distal filling, right? Or it had happened in the future, in the past, when you see that white decalcification and you go with the ultrasound, and then the ultrasound goes straight into the dentin, and there you are, you've cavitated the tooth. So when I see those types of lesions, Curodont, I apply Curodont, and Curodont is a treatment that is being attracted by the lesion because it has a more acidic environment, and then it attracts the calcium and the phosphate from your saliva, from the patient's saliva, and rebuilds the hydroxyapatite, which is the bulk of the enamel.
Thank you.
And it's really fascinating. I've had a great result. Sorry to cut you off. I've had great results so far, and I am monitoring and documenting those patients that are coming for their 6-month periodic exam, and it's nothing but pure joy to see that we've been able to save teeth without the needle and without the drill.
Fantastic. So. But hearing about the results is fantastic. What results have surprised you the most? And have there been any patient stories that really stand out for you since you started using this?
I would say 16-year-old girl. She and her mom came to my practice, and the lesions were on from premolar to premolar, not to mention molars as well. My hygienist did the scaling and the root planning because she had a lot of buildup in between the gum and the bone level. And then a few weeks later, they removed the braces and we applied Curodont. I would say 6 weeks after that, we saw that the lesions started to become, the color started to become more of the color of a natural tooth. She is about to follow up with me at the end of July, and I'm dying to see the results because I've documented the before, and I will take pictures from the after we have applied and treated those lesions with Curodont. And I'm so excited because I trust and I know that the results will be phenomenal.
Amazing. So, I mean, with your preventative focus, do you think healthcare in general spends too much time treating disease and not enough time preventing it from what you see?
Yes, I would say that unfortunately, insurance companies would rather pay for the damage when it's done versus paying for the preventive dentistry. And it works in almost every medical field. I feel that they're more willing to pay for that versus screening and preventing problems that could be avoided on 100%.
Thank you. So coming back to the AI that you were talking about earlier on, there's a lot of fear around AI in replacing clinicians. A lot of it's unfounded, and you clearly have a different perspective. How do you kind of treat the new technologies coming in dentistry, particularly with reference to things like the AI that you were talking about earlier on?
I think that the most important thing for clinicians out there who are just starting to utilize AI in their practice is to know that AI is not here to replace the clinical decision. The clinicians are the ones who put the diagnosis and the treatment. AI is here to help us. They're here to help us bridge that anxiety and that lack of transparency between the clinician and the patient, because AI has the way I utilize this in my practice is before I see a patient, the first thing that I do is I always open the regular x-rays that we take. I never rely on the AI to give me what the diagnosis is going to be. And it is kind of a battle between the AI and myself, because I say, this is a true cavity, this, and this. And I'm like, let me see what AI has to say. And to my surprise, of course, as I've said it before, the human eye can detect only to a certain degree when the damage is already done. And I would be surprised to see that AI had detected those small lesions that the human eye cannot see. And again, it is totally up to me to decide whether to do a cavity on that tooth, to do a filling on that tooth, or to apply Curodont based on my clinical judgment, because we all know that diagnosis is based on your clinical judgment and the radiographs that you take.
So you have obviously a very balanced view about the AI technology. Are the patients trusting the technology, the ones that you're using and using AI to help you with the diagnosis and treatment?
On 100%. I would say 200%. They do trust us. They do trust me. And I feel that people can sense when doctors are being, more on the sales part, which I don't appreciate. They see the colors. They see the colors. They see what a small lesion looks like. They see what a big lesion looks like. They see the radiolucency on the apex of the root if they have an infection. It's something that before utilizing AI, they couldn't see what I saw, and that was more that put a lot of restrictions and boundaries. The shield was there, and it never went away. And the moment I started utilizing AI and started explaining what they're seeing and how it translates to what I see on the other end, my treatment acceptance got through the roof, and I'm so extremely grateful. And again, AI is being when put in the hands of good people, it could do phenomenal things for the population. You give AI to the hands of people who don't have good intentions, then maybe the results are going to be bad. But in my situation, my patients trust me. I feel more confident explaining what the treatment plan is going to be, and I have a lot of trust that continues to build as time goes by.
Thank you. So you're obviously embracing AI in your work. Where do you think AI is going to have the biggest impact in dentistry over the next 5 years or so?
That is an excellent question. I don't think that AI is going to fully replace or will ever replace the clinical judgment. The only thing that I can see AI, implementing it in the future is to continue to enhance things that we can miss as clinicians, and just pinpoint a couple of things, because just like anything else, if you look back in the days when we first started using or placing implants, people would place implants based on a panoramic x-ray. But we all know that this is a two-dimensional image versus a three-dimensional implant that you need to place within the bone. And we know that the bone is a three-dimensional structure. So what happened was, as we had advanced, the CBCT scan became the standard of care when it comes to placing implants, because it gives you that three-dimensional image of where the nerve is, where the arteries are. So same thing here. AI is being launched in the dental field and in the medical field right now. And the future, who knows what the future will hold, but all I know is that it's going to continue to help not only clinicians, but patients as well, because it does show to the patient what we as clinicians see, but the patients cannot.
Thank you. Are there any risks practitioners should be mindful of in the AI era?
The only thing that I would say for young dentists is to be careful, yes, because it could make them, I wouldn't like to use the word lazy, but the eye could become lazy if you are not as experienced. Solely take a look at the x-rays, have a mentor by your side with whom you can discuss those x-rays, and then do the clinical exam, and then take a look and open up the AI so your eye can be trained to look at both x-rays.
Thank you. So switching gears slightly, I'd love to talk a little bit about the business side of dentistry. What are some of the biggest challenges facing dental practice owners today?
That is an excellent question, because there isn't only one challenge that we face. We face a lot of things that dentists back in the days did not, and that comes with mental, emotional barriers, and a financial burden. I trust, especially here in the United States, is tremendous, because people have insurances, and unfortunately, by the time they need to do a scaling and a root planning or one filling, they exhaust their benefits for the year. And this, as we all know, dentistry is an expensive field, and a lot of the time people are on a fixed income, and that makes it hard for them to continue their treatment. And I feel that this is when people fall into that vicious circle. I'll do one thing at a time, but by the time they come, the problem has become bigger and deeper. And I feel that back in the days, comparing to what, how my mother used to work, because she had her own practice in Bulgaria, I don't think she had ever faced those problems, because everything was a lot less expensive back in the days, materials, just anything and everything. The way things have changed for the last even 5-10 years, it's the gap between I would say the rich and the poor is getting bigger and bigger, and that's the biggest challenge that we face these days.
That's really insightful. So, which challenges or bottlenecks are most impactful to you right now, or if not right now, have been on your journey to where you are today?
Can you just repeat that question? I couldn't hear you.
I was just really asking about which challenges or bottlenecks are most impactful for you in your business right now, or if not right now, at some point along your journey, along the way.
I would say I wouldn't say that it's so much the financial aspect, because at Aspen Dental we do have different payment plans that people utilize. It's more the emotional state that especially when they have to extract all of their teeth. The terminal dentition, that's what I call that. And they postpone, and it takes a lot for me to convince them that they're better off having full dentures, and then down the road we can think about getting more implants and getting overdentures or all on X, versus staying with roots that are filled with infection and etc. And I did have a very bad experience with a patient a few years ago when they refused. And again, if I take out all of my teeth, which were just root tips, it's just I'm going to be completely edentulous. And I'm like, you are already edentulous. So the patient postponed that, ended up in the hospital. Thank God they're still alive. But I would say the mental and the emotional component is the biggest challenge in dentistry these days that we face.
Yeah. I think you mentioned previously that new patient show rate has been an ongoing challenge. How do you think about that today in your practice?
Thank God we have a great marketing team and that help us a lot with new patients. At this point in my practice, I do have a lot of word of mouth. So patients are bringing their parents. Patients are bringing their whole families. So it's getting better and better with new patients show rate. But again, when that declines, there is nothing in the world that can convince me that it's not fear of the dentist. That is what makes the patient come to the door. And I've had patients that they would come to the door, they would see me, and they would just walk away. I'm sorry, doc, it's not you, it's me. I've had patients when I was working in Rhode Island, sitting on the chair, big abscess, I have to take out the tooth. The moment they saw the needle, and I tend to believe I'm very gentle when I administer the lidocaine, they saw the needle and they just jumped out of the chair and ran away. So fear is the number one barrier when it comes to new patient show rate.
It's really interesting, and I guess that's an age-old problem. But is there anything innovative in the dental space that's been able to kind of solve or help with that? Because I guess it's been going around for years and years and years.
If there is someone who's gonna invent a painless way of administering lidocaine or anything in dentistry that's sweet, I think they will be millionaires, billionaires. Unfortunately not. I don't think that at this point we have anything. I do try different techniques to ease that infiltration and to make things less painful. Because if they have that experience as a good experience, everything else is just piece of cake. And I hear that a lot.
So you're a practice owner. You obviously wear lots of hats in the work that you do: clinical, operational, business, administrative. What is your biggest time drain for you as a practice owner that takes you away from the things that you prefer to do?
Long hours. You have to be, when you're an owner, you think about everything. You think about every single person that works with you, your office manager, your practice coordinator, your dental assistants, your lab technician, if you have one, your hygienist, your assistant office manager. You think about all of them. And you tend to spend a lot of hours in the office, which, to be honest with you, I still don't mind, but I wish those hours could be a little less than what it is right now.
And is there anything that in the things that you've just mentioned that keeps you up at night? As a practice owner, what's the kind of the biggest worry that would keep you up at night or wake you up?
My biggest worry is always the patient. A patient who I did a root canal treatment but swelled, who knows why. A patient that I placed an implant but is in pain 3-4 weeks since the day we've planted that implant. Patients are my biggest, I wouldn't say nightmare, it's a sweet nightmare, but if I could have a magic wand, it would be all of my patients are free of pain, happy, and come back just for a periodic exam. That would be the perfect scenario. And I would say that majority of the time I have achieved that, and that is because of the hundreds of hands-on courses that I had attended that gives me the stability. Stability comes when you have solid knowledge, because you connect the dots and you know when to worry and when not to worry. So patients will always be number one priority in my life.
Thank you. You mentioned a moment ago your various team members that you have. What's your approach to building a team that shares your values and your patient-first philosophy?
Oh, that's a tricky one. So I do have standards that I hold up myself up to, and this is how I choose my teammates. And it is hard. It is hard because people don't have the same work ethic as I do, especially the newer generation. That makes things difficult for majority of the people that I've been working with. I choose very, very carefully. I prefer to work alone versus having people who are going to disobey what I have built. The rules and the regulations. Not to mention that there are still rules and regulations that I live by because I'm still under the umbrella of Aspen. And I give that as an example so many times, especially to the younger generation when they just want to come to work and look at their phones, and the lack of accountability and the lack of not being able to have a normal conversation without somebody getting offended is very, very hard. And that's why I prefer to work alone sometimes, but have the right people by my side versus having 20, 30 people who are just there to exist.
Got it. So where do you think you're going to be in the next 12 months? Are there any particular goals or aspirations you have for Aspen, your career and your career path in the next 12 months?
Next 12 months, I will continue as we speak. I'm in North Carolina, taking a master class in general dentistry, bonding, which is my bread and butter. I love restoring teeth with composite. In the next 12 months, I will take master classes in restorative work when it comes to implants. I've done the Maxi course last year with the American Academy of Implantology. The surgical part will always be something that I am thriving to improve. My incisions, my suturing techniques, restoring those implants to me is one of the most important things because of the biomechanical aspect of that. So hands-on courses ahead of me, and continuing to deliver impeccable dental care to my patients, minimally invasive.
Wonderful. And what do you think the wider world of dentistry is going to look like in, say, 10 years from now?
I hope for the better. I hope for, if I have to picture dentistry in 10 years, I would picture contemporary look. Everything is in beige and white colors. There is no rushing. People are more united on preserving the natural dentition and not destroying. If and when possible, and more united society, more united dental society, less criticism, more study clubs, more vulnerability between dentists, because I feel that majority of the time we don't talk about our failures, and they do exist, maybe because of shame. I don't know, but I would like to see the dental community more united in 10 years.
Wonderful. And finally, if you were starting out again tomorrow, starting your career again tomorrow, would you do anything differently with the benefit of hindsight?
Yes, I would start more slowly. Yes, I would invest. I will continue to invest in my education, but I would master one thing at a time. That's something I started doing 6 years after I graduated dental school from Bulgaria. And I trust that if I had started that since day one, I would have become the version of myself a lot sooner.
Amazing. Roumiana, this has been a fantastic conversation. Thank you so much for joining me today. I think what stands out is that you're showing what healthcare looks like when we combine prevention, technology, and clinical expertise rather than waiting for disease to progress. So thank you for sharing your experiences, your insights around minimally invasive dentistry, and your perspective on where the profession is heading. I really appreciate it.
Thank you so much, Dr. Greenland. It was truly a pleasure speaking with you today.